we give now the talk for the next presentation, which is in fact Pavel Stodulka.
This film is about a patient who was blind for 16 years and who had his vision restored by a surgery in which 2 artificial corneas were used. The patient could only see with his better eye hand movement with correct light projection. Because the cloudy cornea was thick enough, we decided to attach the artificial cornea in the patient's own cornea. The surgery wasn't easy. First, the large blood vessels on the eye surface were cauterized. A radial mark was created on the cloudy cornea. Then, the cornea was triphined. Using a diamond knife and curved scissors, the cornea was separated. We have created an entrance for the phaco tip at the side of temporary silicone keratoprosthesis. We fixed the temporary artificial cornea with interrupted stitches. The anterior chamber under the temporary cornea was filled with OVD. Capsular hexis was performed with endoforceps through the modified entrance at the edge of the temporary silicone artificial cornea. Hydrodissection was followed by phacoemulsification of the lens. The residual cortex was aspirated by bimanual irrigation aspiration. The anterior chamber was deepened with OVD, and the hydrophobic interocular lens was implanted in the bag. The stitches were released, and the temporary artificial cornea was replaced by a Boston K-Pro artificial cornea, which was attached to the patient's own cloudy cornea. The backplate of the artificial cornea is made of soft acrylic and was developed at our facility as an improvement to the hard titanium original part of the Boston K-Pro. The complex of the artificial cornea with the patient's original cornea is rotated according to the radial mark to the original position and fixed with interrupted stitches. At the end of surgery, the eye was pressurized. The first day after the operation, after the eye was uncovered, the patient could see after 16 years of blindness. Visual acuity was 0.5 uncorrected, and the patient rejoiced that he could recognize different colors of shirt sleeves and even read without glasses. He also looked at his face after 16 years. He and his family were exceedingly grateful. His son says they were surprised he could see so well after such a long time.
To efektu, mówię, sami się nie spodziewaliśmy aż takiego. Do dzisiaj mówię, no jesteśmy w szoku po odklejeniu opatrunku, że tak można widzieć, tak? 16-letniej przerwie.
2 months after the operation, he saw 0.7 uncorrected and with a correction of -1 cylinder in the 130-degree axis he saw at 0.9. Up close, he reads at Jaeger 1 naturally. 7 months after surgery, when the borders were closed due to the coronavirus pandemic, in Poland, he underwent occlusion of the retinal vessel of the right eye, which worsened his vision. 1 year after surgery, he can see 0.2 uncorrected, and his corrected visual acuity was 0.3 with -1.5 diopter. The patient and his family are still extremely grateful, and they even brought their granddaughter to see the place where her grandfather's vision was returned to him. Thank you for your attention.
I'm open for questions.
For sure, this is Pavel. This is extreme surgery, and congratulations for having being that brave to face it and to study it and to make it in such a good way, with such programmed way, because this is exceptional. I think the emotion of restoring vision after 16 years interruption is great. And our emotion in seeing your surgery is also great because you faced two problems, actually. The first problem was to understand the anatomy of this eye. Maybe the echography has helped you, and to plan for the surgery. And the second problem was to fix the Boston K-Pro in that way you used. Can you tell us something about the PMMA or the acrylic platform you used?
Well, I have a very long experience with K-Pro, and one of the problem is that these K-Pros do not retain in the eye forever, and they get extruded. And I think it's probably also due to the material properties. Two hard materials in between the cornea is sandwiched. And I believe a soft, it is a hydrophilic acrylic backplate, just decreases that risk. And we have just engineered that at our clinic and cooperated with one of the IOL manufacturers. And this is a material, the same hydrophilic acrylic material as is used for intraocular lenses. And I believe, hopefully, this can increase our chance of long-term results. Our first patient with Boston K-Pro is almost 15 years after surgery, still living with no glasses. That lady was actually also 16 years blind before the surgery. So it's really a great satisfaction for the whole team to return the vision to such individual. And I'm really happy we can do that from time to time. We have about, I think, 15 patients with long-term results, which really changed their life.
Pavel, you are a great surgeon. However, there is a question from the audience. What about the intraocular pressure? Will this eye or other eyes develop glaucoma over time? What do you think? Can you check intraocular pressure through the peripheral part of the cornea, or not at all?
That's a very good question. There are several risks associated with artificial corneas, endophthalmitis and glaucoma being the most common causes of blindness after this surgery. And all these people apply topical antibiotics with anti-inflammatory drugs during the time they have the artificial cornea. And to measure the pressure is really not possible. We can estimate, we can do some attempts to measure, but to my experience, it's more guessing than measuring. So either we just observe the optic nerve, we do the OCT for the optic nerve, and we just also try to to follow the patient, because these patients can also estimate their visual field and self monitor it a little bit, but it's a long-term risk, and sometimes we decide to do some anti-glaucoma surgery, being that laser, transscleral cyclophotocoagulation, or even some drainage surgery. But it's a little bit of headache. So yeah, that's it. And I think with the soft backplate, we lowered one of the risks, but we still need to watch the other risks.
Pavel, a last question. The artificial cornea is the holy grail of the anterior segment surgeons. Do you see any projects around the world that seems promising for the future?
Well, there is one project in Israel. It's a really multi-material, high engineering artificial cornea, which we will see how it works. And actually, we run our own project, which goes a little bit other way. It's a purely silicone cornea, which can be injected into a 3mm hole in the cloudy cornea. And we have our first lab results. We haven't implanted that into the human eye yet. So there are some projects. We'll see. There were some projects with biosynthetic collagen, but that material seems to be too weak, and the mechanical properties are not really strong enough. So it's still a long way.
So we will wait 1 year for your new video, Pavel. Great job. Great job. Congratulations. And now we